let's hear from Mr. Silas. Good morning, sir.
Good morning.
Yeah, how?
I'm very fine.
It's good to have you today.
Thank you very much.
Yeah, you as a corporate relation, tell us about yourself and what you do at Urological Hospital.
Okay. First of all, I just want to say that we are pleased to be here,
Yes.
even to host our executive director,
Yeah.
the manager of Bloom Hospital, who will introduce himself maybe as we continue.
Yeah.
I want to say that Bloom Hospital actually now is one of the biggest hospitals in Nakuru, with the only hospital with cath lab in the entire Nakuru. Bloom Hospital provides exceptional medical care with world-class expertise,
Yeah.
meaning that is I can say multinational.
Yeah.
We have doctors not only from within but even foreign.
Yeah.
So Bloom Hospital is also believe in partnership with other stakeholders,
Yeah.
including corporates. We have insurance providers, and some of them actually are. And maybe before I continue, maybe I need to salute them because this is a customer. This is a customer service week. We have big ones, so I don't know if I can maybe salute them.
Okay, it is okay.
Yeah, we have like geothermal development, that is GDC.
Yeah.
We have KCB. We have cooperative bank or mutual bank.
Yeah.
We have also insurance providers. Those have been with us in the journey.
Yeah.
We have like AR, APA, we have St. Andrews. Those are some of the corporate and the insurance. So I want to say that Bloom has got more than 27 in insurance covers. And also Bloom Hospital is both inpatient and outpatient. We have units. We have a chemotherapy unit. We have dialysis and renal unit. At Bloom Hospital also we have the units that's maternity, there's pediatric there, there's gynecologist there, resident one.
Okay.
Yeah,
Thank you so much. I think we are going to have more about what Bloom Hospital does and the partners and those people who are there to make sure that the hospital is working. But you will allow us also to hear from our Dr. Shihab. Good morning, sir.
Good morning. Good
Yeah.
morning.
How's the feeling?
I'm very fine.
Yeah, it's good to have you today.
Welcome. I am very blessed to have this meeting with you at Mamlaka TV. Thank you.
You are welcome. You know, the public is very curious. They want to know about urology, and I think for me it's the first time I'm hearing about the term urology. Can you please tell us something about urology and exactly what you do as a consultant here?
Of course. First of all, I believe that I have to introduce myself. I am Dr. Shihab.
Yeah.
Shihab Imad Al Amir. I am consultant of urology and male infertility at Bloom Hospital.
Yeah.
Bloom Hospital, as Mr. Sila said, is one of the biggest hospitals all over Nakuru. It is located at Golden Life Mall at Nakuru Eldoret Highway. We at Bloom Hospital offer a wide surface of consultant in different specialty of medicine. If I'm going to move to my specialty as a urology and male infertility, which means that we are dealing with any issue or any disease or any pathology related to the urinary tract. Urinary tract means the kidney, the ureter, the urinary bladder, and the prostate. And of course, we also handle any issue about the male infertility, such as the infertility issues for the male factors and other issues related to the main sexual health. All of these is called a male infertility. So this is a part of our specialty.
Okay, fine. I've heard you mentioned about urinary kidney functions and if it's failing. So when you talk about urology, of course you have also mentioned something about male infertility. Sorry. So when that person who is watching that wants to know what are the signs of symptoms that he or she may be suffering from this kind of disease, like he has a kidney problem. Yeah.
Okay, for the kidney problems, we usually divide it into two sectors. Okay, there is a surgical part and there is a medical part. Okay, our specialty mainly depend on or deal with the surgical part of the kidney issues, such as if there is stones, kidney stones, or stones all over the urinary tract, such as in the ureter, in the bladder. Also, any tumor disease affecting any part of the urinary tract, we can also manage. Another part is about the prostate. Also, as you know, prostate disease is very common in the elderly people. Either it is a benign enlargement or it is a malignant enlargement of the prostate.
Yes.
So either it is a benign or a malignant issue, we need to handle it under the urinary tract or under the urology specialty. For the male infertility, we usually define the infertility is if there is a failure of conception after 1 year of a regular marital life or a regular sexual life.
Yeah.
So after 1 year, if any husband and his wife didn't get conception, this can be considered as a primary infertility. So we usually advise them to seek for a medical advice after 1 year. So search for both the male factor and the female factor. But for the female factor, this is our specialty.
Yeah.
If we are going to talk about the female factor, we usually advise her to go for a gynecologist.
Yeah. Okay. Thank you. But before that, remember this month, the month of October, is the month for creating awareness, specifically when we talk about urological health and the community to know about what is happening, what are the type of disease it is, and how they can heal from it. Maybe to you, Mr. Silas, how is Bloom Hospital creating awareness when you talk about urological health?
Okay, Bloom Hospital actually has a big network of partnership. And also, one of them is like this platform. We have engaged the media team. They are our friends at this time. Also, events in this county, there are many events. Actually, some are planned by the government, some are locally planned. And the part of the mission of Bloom Hospital and also the vision is to engage with the community to ensure that the customer, the client, have the better experience. So first we put Nakuru in front. So we pay attention to all upcoming events that are around here, and we attend them. We sponsor them also. We participate. Like we have the upcoming marathon event. We are going to be in it. Also, there's a golf club event. We are going to be there. When we are there, we create awareness. We talk to them about well-being. Because actually now, you know that in the past, majority maybe of Kenyans, they never knew the importance of checkups. But the development world, like Japan, is a mandatory to have checkup once in a year. Is a mandatory. So now many people are waking up. They're getting to know this. So and that's why at Bloom we value them, and actually we have put all the strategies and our standards allow them to actually get everything. Yes.
Okay, thank you. Thank you for that. And it's good to create awareness because we have people who doesn't know even if there is things to do with when you talk about urology, and of course the doctor has talked about male infertility. Sorry for that. But to you, Dr. Shehab, sometimes we find it difficult because when you mention these things in public, people may shy away. What's that something that got you by surprise from a citizen who came to seek medical advice?
Okay, I just want to confirm that when we are going to seek for a medical advice, it is not about being shy or not being shy. It is about your health. So you usually advise not to be late. Okay, if you have any issue about your urinary tract or about your health in general, either it is a sexual part or it is a non-sexual part, you have to seek for the medical advice. Because if you are going to present yourself late to the doctor or to the consultant, it might be too late for you to be managed in your case. For example, we have seen a lot of cases, they are presented with a prostate issues. And unfortunately, due to the enlargement of the prostate and the negligence and the delayed presentation for the medical advice, it affected not only on the prostate, but also it caused for them what is called a chronic retention and reflux, which affect on the health of their kidneys. So it ends with them with a renal failure and dialysis. So, for example, this is an example for the late presentation. So usually advise all of our audience and anyone asking for a general advice not to be late. Just listen to your body. Your body usually send you an alarm. We usually say the symptoms that you feel is an alarm, but this alarm will not be a continuous alarm. It will be an intermittent one. So you have to take care and to listen to your body. If your body sending you an alarm, you have to seek for a medical advice as urgent as you can. So you are sure and you are comfortable that your body is okay. And if there is a problem, you can manage it in the early stage. So again and again, also the screening is very important. As Mr. Sila said, in the developed countries, in Europe, in Japan, they usually conduct an annual programs for screening. Not only for the urinary tract, but also for other systems in our bodies. But unfortunately, in Africa in general, we don't conduct these regular programs for screening. So usually advise our audience to listen to your bodies and seek for a regular screening programs. At Bloom Hospital and in the field of urology, we can offer you the screening program for the health of your urinary tract. We can do a regular ultrasound. We can do some lab tests such as kidney function tests, UECs, to take care about the function of your kidney. Also, we can do what is called the BSA test. BSA test is very, very important for any man over the age of 45 or 50 years, because it gives us an idea about the health of his prostate. Either it is a benign enlargement or it is a malignant enlargement. So we can deal with it, we can manage it in the early stage.
Okay, thank you. Like for example, here in Kenya, we have had reports about patients complaining about their kidneys and how they have to go for screening and checkups. For that person who is watching and asking questions that he or she might want some answers. Like for example, what are some of the signs and symptoms that one should have, rather has, that you as a doctor can say that these can result to a kidney failure?
Okay, any change in the urine, either in the color or in the odor or in the amount, should consider a medical advice. Because we consider the change in the urine as the first or the early symptoms for the renal failure. So if you have any change in your urine aspect, either in the color or the odor or the amount, either it is decreased or increased, you have to seek for a medical advice. Another point is about what is called the flank pain. Any pain you feel in your abdomen, especially in the flank area, which the kidney is located, you also have to seek for a medical advice. Also, as we are in October, as you know, is a month for the screening and awareness for the cancer disease. So we usually conduct a campaigns for increasing the awareness about the cancer of the prostate in men. Here in Africa, we have a high incidence of cancer prostate, and it is considered for worldwide one of the highest incidence of cancer prostate in Africa. So we usually conduct a screening for the cancer prostate, and we usually advise any man over the age of 45 to have a regular PSA check. PSA is a lab test. It is a very simple test. Okay, it is just a small blood sample we collect from your body. We analyze it in our laboratory, and it gives us an idea and an indicator about either the progress or the growth of your prostate is a benign or it is suspicious for any malignant foci. So if there is a suspicious for any malignant foci, we have to proceed for the further steps for investigations to either confirm or to exclude the presence of any malignant foci. As long as we can diagnose it early, as long as it will give you a better prognosis and a better overall survival.
Well, thank you. To Mr. Silas, we have heard about the signs and symptoms of patients who are suffering from kidney failures or any other disease. Sorry, not Silas, but Mr. Sila. You will forgive me for that. But do you think the public is coming to the doctor to get some treatment rather for a checkup as we create more awareness?
Okay, what I can say is that ever since we started putting measures, running campaigns,
Yeah.
actually we are receiving positive feedback because what we value much about the client feedback.
Yeah.
And actually we have great testimonies.
Yeah.
With the hospital, with the only cath lab in the entire Nakuru, we have testimonies. I cannot mention maybe the names of
Yeah.
those patients. Some were having heart blockage, and actually they were helped at Bloom Hospital. And you can see that Bloom does not only, they don't compete with other hospitals, they complement each other. In fact, we have good partnership with doctors, and they're working together to ensure that the public get to know what is happening. And when such testimonies go around, go viral, I want to tell you there are like 5. Now they are viral. They are in the internet of someone who was dying. In fact, she was considered like dead.
Yeah.
And then actually revived at Bloom. So when public see such kind of testimonies, they are coming. Because, education was earlier on, people were not educated.
Yeah.
But people are becoming wise. They believed in much in the traditional medicine.
Yeah.
Right now, people are understanding considering the life expectancy. Because when you see the developed world, their expectancy is higher than the African.
Yeah.
So when they are beginning to understand that, they're coming. Yeah.
And sometimes people say maybe the environment has changed our habits, the way we do our activities. Does it mean that we are doing something that we were not doing that is resulting to these diseases that we are talking about right now? Yeah.
Okay. Some diseases are lifestyle, what we consume, and as we have a doctor here, I know also you add on that. What we eat, actually, the lifestyle diseases, the incommunicable ones, are everywhere. And people are now the complacency, the lifestyle.
Yes.
Earlier on, they were working hard, hard works. Nowadays, office, you sit in the office from morning to evening and you're not exercising. So, with education, some are taking action, and actually those who are taking serious action are getting helped. But those who delay, what I can advise is that being that we partner with doctors all over Nakuru, and also not only here, doctors are working hard, and I value them today as this is a customer service week. They're really working hard. As you can see, even me, I'm not resting. I'm everywhere.
Yeah.
So to ensure that the public get to come out of this, they were entangled in. So they're coming out here.
Wow, thank you. Dr. Shihaba, the way Mr. Sila has just said, many people are coming for checkups. Now, can you tell us the whole process of screening and testing here? Yeah.
Okay, we can offer a full program for screening. If you are going to talk about the health of the urinary tract, we usually do an abdominal ultrasound.
Yeah. And
we usually do some lab tests, such as full hemogram. We can do the kidney function, and as I said, if he is a male, we can do a PSA, especially if he is more than 45 years. Okay.
Yeah.
Of course, we do also a urine analysis, and we do a physical examination. So this is our screening program that we can offer, and that we usually offer for screening. By this program, we can detect and we can make the screening for the most common and popular diseases in the urinary tract.
Yeah.
And by the way, this program is not only for the adult people. We usually also conduct it for the children.
Even
because,
children.
as you know, in the children, we usually found that there are a lot of what is called a congenital anomalies, and it is neglected or it is not diagnosed by the mother or by the parents. For example, one of the most popular and common congenital anomaly that we usually find it accidentally during regular examination is what is called undescended testicle, in which the children or the child has a hanged testicle, either unilateral or a bilateral one.
Yes.
And this is one of the most popular and common congenital anomaly. And we usually advise our colleagues from the pediatrician and the gynecologist to examine any male infant immediately after delivery.
Yeah.
And if they didn't feel the post testicle inside in the scrotum, we usually advise them to refer this infant to a consultant of urology.
Yeah.
And also we have what is called a golden window for the management of this disease, which is below 1 year of age. Because after this window, after the age of 1 year, the health and the function of this testicle is usually affected.
Yeah.
So we usually advise any mother to examine her infant or her child, and if she is in doubt that one or both testicles are not in the scrotum, to seek an advice for a consultant of urology, especially before the age of 1 year.
Yeah, before the age of 1 year. And Mr. Sila just told us maybe it was just from the things we do, the type of food that we eat can result to this problem for kidney failure. You as a doctor, can that be true?
Of course, our lifestyle and our habitual and the food we take can affect negatively or positively on the health of our kidneys. For example, the sugary diets, the carbonated drinks, drinking a lot of alcohols, smoking, all of these are very risk factors that can affect the health of our kidneys. On the other hand, if you are taking a healthy food, if you are taking a lot of vegetables and fruits, this will provide your body with what is called antioxidant. Antioxidant is a particles that engage with the free radicals in our bodies. Free radicals is the toxins in our body. So antioxidants engage with them and deactivate them from our body. So this will preserve and protect the health not only of our kidneys, but the health of all organs of our body. So we usually advise, as a matter of keeping health of your kidney, to drink a lot of water, at least between 2 to 3 liters per day, and to consume a lot of vegetables and fruits, because they are very rich in antioxidant material.
Okay, thank you. We are going to take a very short commercial break. When we come back, we are going to receive some questions from our public or our viewers who are watching live there from home, those who are at workplaces and they are watching. If you have a question today, remember we are talking about urological and community health as we raise awareness, this being a customer week. And today we have Dr. Shihab from Bloom Hospital, who is a consultant, and also have Mr. Sila Oko, who is a corporate relation. If you have a question, feel free to use those numbers below your screen, 0721 899 899. Also, or you can also use that number below your screen, 0700 899 899. And when you come back, we are going to have a look at those questions, and our doctor will be helping us with that, or rather with your question. Don't go away.
Step into a brighter future at Better You School. Conveniently located in Barnabas along the Nakuru-Nairobi Highway. We are ready to nurture young minds from playgroup to class 1, providing a foundation for a lifetime of learning in a serene Christian setting. Enroll in the ongoing intake and take a step into a world of discovery and growth.
Located just 400 meters off Ruby's petrol station, on the way to Luna Hotel, we are at the Chosen Generation Church Barnabas Sanctuary. To secure your spot, call 0790 899 899 or visit us at the Chosen Generation Church Barnabas. Better You School, bettering your future.
Step into a world of beauty and elegance, where we bring you the latest and trendiest beauty products and equipment that cater to your every need. From luxurious skincare essentials infused with natural African ingredients to a wide array of makeup products that celebrate the diverse beauty of East Africa, we have it all. At East Africa Cosmetics, we understand that beauty comes from within, That's why we also offer a hand-picked selection of holistic wellness products to nourish your body and soul. With our state-of-the-art beauty equipment, you can now bring the salon experience to the comfort of your own home. Discover top-of-the-line hair dryers, beauty tools, and grooming essentials that will leave you looking and feeling your best. Whether you're a makeup enthusiast, a skincare devotee, or a salon professional, East Africa Cosmetics is here to support your beauty journey every step of the way. But wait, there's more. Our knowledgeable and friendly staff is always ready to assist you in finding the perfect products tailored to your unique style and preferences. So, why wait? Visit us today at Jala Plaza Nakuru, Gusii Road adjacent to Kenyatta Avenue on your way to Tidy's Hotel, or Carnation Building along Mosque Road opposite Showmut Plaza. Call us on 0721 340 643. Visit our social media platforms, East Africa Cosmetics. And let East Africa Cosmetics be your trusted partner in beauty and wellness. East Africa Cosmetics, where East Africa's beauty comes to life.
Naam, karibu tena mtazamaji. Kimekuwa kipindi kifupi cha mapumziko, and we are back. We are live on Facebook, Mamlaka Television, on YouTube, Mamlaka Television. And now this is the time I'm going to have a look at those questions that we are receiving from our social media and through our WhatsApp numbers. And the doctor will be helping us. Remember, we have Mr. Sila, who is a corporate relation at Bloom Hospital, and we have Dr. Shihab, who is a consultant and a male infertility doctor at Bloom Hospital. And remember, as we raise awareness, it's also good to visit this hospital for treatment, early treatment. Remember, this disease can be treated. If you visit the hospital early enough, then you are going to get a medicine that will help you to make sure that you recover from that disease. Yeah, Mr. Sila, I remember this is it's good you reminded us this is a customer week, and it's good that we also educated the public and the importance of creating awareness. And this week it's so good, it's so nice I'm having you guys from Bloom Hospital. Now, when you talk about campaigns, Bloom Hospital, you as a corporate relation, what are some of the things that you are doing? Like, for example, can you tell us if you have launched any program, rather an initiative that makes sure that the public understands about these problems that we are having a look at?
Okay, Bloom Hospital, as I told you before, we value first the community.
Yeah.
That is the local Nakuru one.
Yeah.
And actually, there's a program called Bloom Mama. Bloom Mama is a real program.
Yeah.
It's a national project of Bloom Hospital.
Yeah.
It will come to intervene, to mitigate the challenges that our mothers have been facing during antenatal period. It's a package that really has a lot of discounts, a lot of goodies. There's a lot of benefits. We have workshops, webinars, training for mothers, and also on nutritional supplements. They'll meet their gynecologists, physiotherapists. They're all there at the same time. So actually, the people have already joined, mothers have joined, and they're joining every day. So with this campaign, we are targeting actually to reduce casualties during this journey with our mothers, because you know the slogan of Bloom Hospital. You are our journey, you are our priority. So actually, we want to ensure that all the members of the public, the Bloom, the Nakuru residents, are able to walk a healthy journey during this period. Yes, and not only that, also we have other projects that we are supporting. Like I've told you that almost all the events here in Nakuru, like the expos that are always there, we are always part of them. Actually, we always take the lead, the platinum part. And also you see, like in golf club, we are also going to be there. The Mao Marathon, the government one. We are supporting it. We are going to be part of it. And not only that, when also other people come to us, we give them room. We talk to them. Our manager always talk to them. So I can say that we have a real planned campaign.
Wow, thank you. Dr. Shihab, you know, when you talk about campaign and raising awareness, you find out that one of our viewers who has just asked a question, because when you talk about our lifestyle, When a child develops some complications, can it be because of the way the parents try to feed them? You find out that many claim to be maybe it can be a result of witchcraft. How can we change this narrative?
Okay, our lifestyle. We have to take care about the lifestyle and the habits, the daily habits that we usually do. The lifestyle is very important. And if you are going to talk about the lifestyle, it can be for both children and adult. As a general advice, we have to listen to our bodies. We have to watch for the alarms that our bodies are sent to us. If we are talking about child, so it is the responsibility for the parents to take care about their children. If there is any abnormal behavior from the child, they have to also to listen for it. Okay. Another point is about doing exercise. Doing exercise will help us to maintain the health of our bodies, the health of our heart, of our kidney, and all of our body will be healthier. The joints, the muscles, whatever the organ in our body will benefit from doing regular exercises. Okay, practicing sports, taking a healthy diet, avoiding the toxic food or drugs. Okay, the fast foods is very risky. It affects the health of our children. It affects the health of our hearts. So we usually, all of it is about our lifestyle. We have to avoid the sedentary lifestyle. We have to do some exercise, to take a lot of water. If we are taking care about our lifestyle, I can assure anyone that he will maintain the health of his body, not only the health of his kidney or the health of any organ, the health of all over his body.
Okay, thank you. And you can also tell us about the treatment of this disease here.
The disease for the kidney.
Yeah, for kidney.
Yes, the disease for the kidney, as I said, it can be divided into either a surgical part or a medical part. So we usually do the screening by the ultrasound. We usually do some lab investigation, and might be after that we can proceed for another investigation such as the CT. So we can reach to the final diagnosis. What is the problem about the kidney? The problem about the kidney can be either inside the tissue or what is called the parenchyma of the kidney, or it is a postrenal, which means that there is some sort of obstruction rather than maybe due to a stricture in the ureter, maybe due to a prostate, maybe due to a stones, or a tumor or whatever, or a congenital anomaly. I have some sort of the congenital anomaly that can affect the kidney, which is called a BOJ. We usually find it in the children, or it is called a posterior valve, another congenital anomaly. So after we do our investigation, we can reach to the final diagnosis. If the problem is in the parenchyma of the kidney, unfortunately it become an irreversible damage. And the main two factors that can affect the parenchyma of the kidney is a chronic disease, such as the hypertension and the diabetes, especially if they are uncontrolled diseases. Okay, so this damage or this affection to the parenchyma or the tissue of the kidney is usually unreversible. But our aim become to preserve the remaining part of the function of the kidney. So we usually give the patient a nutritional plan. We give him some medication to support his kidney. We usually avoid also what is called the nephrotoxic drugs that can affect the health of the kidney, and we give him some advice, and we do a regular follow-up with him to take care about the function and the health of his kidney, and to manage it on a short intervals. Okay. But if it is a surgical portion, or if it is a surgical cause for the pathology or for the disease affecting his kidney, we can manage it. Either by open surgery or by laparoscopy or by endoscopy. And by the way, at Bloom Hospital, we can offer all of these modalities. We have a full set of endoscopy. We can manage all the diseases of the urinary tract by endoscopy, which means that there is no cut in your body.
Yeah.
So we usually go through a normal passages through our bodies, and we go to reach the affected portion. Either it is the kidney, the ureter, the bladder, the prostate, the urethra, whatever, and we can manage it with no cut in your body. This provide you a better outcome, a better post-operative recovery, and a little morbidity post-operative. Another option is about the laparoscopy. By the laparoscopy, we can go inside the abdominal cavity by a small incision, like an insect bite. Literally, it is not a large incision. It is just as an insect bite. We go inside your abdomen, and we can see, we can diagnose, and we can manage whatever the pathology affecting your urinary tract. We can manage up to the renal tumors, which is the most aggressive pathology in the urinary tract, by this laparoscopy machine. We have it at Bloom Hospital, and we are well qualified to do the laparoscopy maneuvers. We can do the resection or the removal of these tumors by the laparoscopy, and also use it for another. We can use it for the removal of the bladder tumors, and we can use it for the management of pathology in the ureters. And in the children, we use it also for the management of cases of undescended testicle, as I said. So we can use it for the diagnosis and for the management of many diseases in the urinary tract.
Wow. And of course, you mentioned earlier something to do with male infertility. Can kidney problems lead to male infertility? Yeah.
Okay. For the patient with kidney failure, they have a generalized fatigue and a poor performance due to the accumulated toxins in their bodies. So it affects on their fertility, and it affects in their performance, what is called the erectile performance. Okay, but this is not the main cause for the infertility or for the erectile problems. But if you can address another cause, is diabetes. Diabetes mellitus, especially those who have uncontrolled levels of their blood glucose. It is our monster, and it is a very serious issue that can affect our fertility and our erection power.
Wow, thank you. Mr. Silas, you know, it's good when we talk about these diseases, we encourage the public to visit the hospital for early checkups. How are we going to gain or rather get trust from the public to make sure that they go for checkups?
Okay, the standard of Bloom Hospital is very clear. We have a baseline, the standard that is actually is very clear, the policy. And as you know, that Bloom Hospital also is working, is open, is in the social media, is in the public. The government, they are part of our partners, the health practitioners. And as I said earlier, as you see just from our slogan, your health is our priority. We prioritize the health of the Nakuru resident, the public, and also using the social media. And that's why you see we come in public. We are here today in this studio to ensure that the public get to know. And also from the testimonies, as I said from the beginning, you see one of your own, your families. Because those who know the pain of the pain point is their client, and even those who are close to them. So if a patient can come to Bloom with a heart blockage, and then actually tomorrow that old person walks, you know, such kind of feelings, there are action that has got emotions. You know, the public can see by themselves, and this is some of the things that ensure that we value what is called customer feedback or patient feedback. So after we serve them, we also follow them sometimes. We hear from them, because I told us from our mission and vision is we are customer centered. So we have to also understand their experience. How do they feel the service they are getting from Bloom Hospital? So from regular feedback from the patients, and these are members of our own. Some are corporate, because we have both corporate. We also do like when we deal with cataract. You know, we deal with when we do maybe medical camps. You know, we go to the public and we serve them in a way that when they get these services, they do refer others. So this trust is not easy to develop trust, but it's a journey, and step by step, and through action, and also when they see that actually, you know, when we were talking about health, sometimes some of the facilities, some of the modern equipment, you could only get them abroad, but today they have come near. Bloom has brought them near, like Catalab is just near us here. So when someone hear about Catalab, actually it's not easy to run Catalab. It's very expensive. It needs aggressive marketing. But for Bloom Hospitals to sacrifice and to bring Catalab near the near us, or just here in Nakuru, it will show the commitment, because it's a risk actually. So you can see that through this, even the structure of Bloom Hospital, the way it is, you just come and you see for the first time, you really feel that you are somewhere and you are ready to be served. So actually the planning of the facility, the structure of the management, and the system, the policy, they speak for the hospital itself.
And one of the problems we are experiencing as a nation, maybe you have heard of it, competition from the herbal sector. And you find out that from testimonies, maybe you can just, or other people hire people, used this kind of medicine and I was healed, and some just end up being conned. How are you going to build that trust, or rather to balance between the use of herbal medicine and the scientific generated medicines here?
Okay, where we are is I can say is a Christian place. You know, truth will always stand. And people are getting people are now getting knowledge. Everybody is getting learned. In fact, the government is supporting education. These are we at Bloom, we have set our standards. That is what we do. You know, you don't have to come to compete, because actually we have just to set the standards. And something that is workable. So if the patient will go maybe to the hub and come to us, you know, you will see from yourself. We don't have to compete, but it's for the patient, the client to come and see what we offer, see our standard, and some of the things maybe discussing in the public, sometimes we say that education. That's why we have education. People get education every day, because scammers are there. They are everywhere. And as the knowledge increase, also the scammers are increasing. They find a way. They find a way. So the best idea is that we set the right standards, we put the right, we give the right care to the residents, to the public, because we don't only have resident doctors, we have international doctors. So when those doctors are here, they come, they give education. In fact, the best place, that's why we have those webinars, workshops. That's why we have like online, like maybe here where we are. This is a platform where somebody who is going to a wrong direction is getting the right direction. Because what Dr. Shihab Ahmad is now maybe showing here, if somebody is watching this program, I think he cannot get lost.
Thank you. Dr. Shihab, one of the things we have heard from the public everywhere, all over the country, they say when it comes to kidney treatment, it's quite expensive. How are we going to address this issue and make people understand that actually it's just the price? And we also we inform them that if they have a problem, they can be treated and recover from that disease here.
Okay, actually, I want to make it as a mathematical calculation. if anyone feels that taking care about the health of his kidney is too expensive for him, he has to put in his mind that the kidney failure is more expensive than the treatment. Because it will affect him in all his life. It will affect him in his work, in his daily routine. He cannot go to work. He will expend a lot of money to get a treatment. So this is my conception, is the treatment or the screening or the early management is not too expensive. It is better and it is more cheaper than treating the complicated disease like the renal failure. Another point that we wanted to confirm is that at Bloom Hospital, we can offer all our services with a reasonable prices, and also we can accept most of the major insurance coverage, and of course we can accept the governmental insurance, SHA. So most of these people, most of our clients are treated free of charge under either SHA or the other insurance coverage. So kindly, if I have to advise, don't put in your mind the expenses of the treatment or the expenses of seeking medical advice. Just put in your mind that your health is worthy and your health need for you more attention, and whatever the cost that you will pay now for seeking medical advice and for taking care about your health is more cheaper than treating a complicated and the final disease such as the renal failure.
And do you think what we receive from the or what we hear from the public is a challenge, because you find out when people say that when I go for this treatment, I find it is very expensive, and you find out that people go to seek other medical attention somewhere else, and that they end up being misled. Do you feel it is a challenge here?
Yes, this is a big challenge. Because unfortunately, we have found that most of those people who are seeking a herbal advice or a herbal combination, or they are taking some medication from the chemist or from the pharmacy without a medical advice or against the medical advice, it comes with a negative impact rather than the positive impact. We are not against the herbal medicine, but we usually say just to do the diagnosis, the screening, and reach to the final diagnosis, and after that we can make a shared decision between you as a patient and your consultant or your doctor, which is better for you. The herbal medicine is in some occasions it is very beneficial, and myself I believe in it if it is well directed. If it is well directed. But the problem is, or the challenge is, many of our community, they use the herbal medicine without seeking a medical advice. And unfortunately, this leads to a negligence, and this leads to a complication, and this leads to a wrong direction for the medication. So we have to change our mind setup, and we have to put in mind that we are not against the herbal medicine, but we usually advise seek the medical advice first, and then we can make a shared decision, which is better for you. If you take a drug, or you take a herbal medicine, or you take a combination. And by the way, some of our drugs, the main component for them is herbal. Some of our drugs, the main component of them is herbal. But now it is going according to the guidelines, according to a proper diagnosis, according to a proper direction. This is what can I advise.
Well, thank you. Mr. Sila, do you think in terms of creating awareness, we are doing enough to reach out to the public?
Okay. In our capacity, what I can say, I cannot say we are doing enough, but I can say we are doing our best.
Our best,
because actually the population is increasing every day. Medical challenges in the medical world are also increasing. New diseases, and So what we can do is our best. And if another person do his best or her best, combined, we can help. So every step, every small action that one takes is very important. So maybe when I'm here, that's what I can say. As we also partner with other doctors, we are partnering with them. And those who are also wishing to partner with us, is that what we believe in Bloom is that to serve the community, that they have a better experience. So the small effort that you take and also what we take combined together can help us move another step. Yes.
Wow. And what do you feel like going forward? Do we have to change somewhere, like the way the public view, the way we treat some diseases? Do you think we have to change our culture, like in terms of when we hear about people complaining about, we have talked about the expensive or the charges that they receive for them to get treatment?
Okay. First of all, maybe what I can advise is that we need to increase public awareness. People get to understand, first of all, the pro and cons, the best side and the wrong side.
The advantages and disadvantages.
They have to understand the importance of living a good life. And how they can walk a journey without, some of the diseases that they are getting, some of this because of maybe carelessness, or and some are maybe old, is somebody aging. So if they understand early, if they can get the earlier diagnostic, maybe they come to hospital early, some of the expenses can be avoided. So if they get this awareness and public awareness, supported and maybe sponsored, and they get, as doctor said, early diagnostic, some of the expenses can be avoided. So, even the medical field, they do get, to conduct these procedures. Some of them are very expensive, and actually there's nothing that can be done on the other side. But the only way is that we try to do our best, let the client, the public do their best. Also the hospital do its best.
Okay, thank you. Dr. Shihab, see, we are coming to an end of this discussion, but people would want to know, like at Bloom Hospital, what kind of services can they receive at Bloom Hospital?
At Bloom Hospital, we have the concept of we are bringing the high standard medical services to the community. So you don't need to travel anywhere. So any type of medical service you need, you will find it indoors at Bloom Hospital. At Bloom Hospital, we have a wide scope of medical services, starting from the outpatient services, moving to the inpatient services. For the outpatient service, we have outpatient clinics. We have more than 10 different consultants in different specialties of medicine, such as ophthalmology, cardiology, orthopedic, general surgery, gynecology, urology, and others. Also, we have a full laboratory unit. We have a full radiology unit in which we have a CT scan. And by the way, CT scan is one of the latest and modern tools of diagnosis. Moreover, we have a maternity unit. And for the inpatient services, we have dialysis unit, chemotherapy unit. We have, as Mr. Sila said, the only cath lab unit all over Rift Valley region, not only in Nakuru. And the cath lab unit, to be clear for anyone, is that the unit who deal with any acute condition or chronic condition affecting our hearts. So any problem in your heart, we can manage, we can diagnose, we can treat in our cath lab unit. And also we have ICU and a theater. In the theater, we have 3 theater rooms in which we run one for the endoscopy. We have a GIT endoscopy, urology endoscopy set, laparoscopy, gynecology, arthroscopy, all the endoscopy maneuvers that can be done, we can do it efficiently at Bloom Hospital by our consultant. And all the surgeries, the open surgeries or other type of surgeries, also for starting from the pediatric to the adult to geriatric in different specialties, all of these surgeries can be done also at Bloom Hospital. So all the services you need, you will find it at Bloom Hospital. Of course, we have a dental unit. We have an echo machine to diagnose the problems of the heart. We have an ultrasound. So any service that you need, you will find it at Bloom Hospital.
Thank you, Dr. Shihab. Now, Mr. Sila, people would want to know where this hospital is located here.
Okay, Bloom Hospital is here in Nakuru. Going to Life Mall. There in Colin, at first floor. You will find us there. And maybe also as a wind up, there's a new program called Blue Mama.
Blue Mama.
Exceptional. You know, Lama's classes, you hear some places charging. But at Bloom it's free. It is a package that is full of discounts. And it's not only for the antenatal period, even 6 months postnatal. So you're welcome to join the mothers who are watching and those who are planning for motherhood. Bloom is where to go. Thank you.
Okay, thank you so much, Mr. Sila. Now, because this is customer week, what should the public expect from Bloom Hospital?
Okay, Bloom Hospital, first of all, as we told you, is that your experience, we value much your experience. That's why our standards are very high. During customer service week, actually, just visit. You visit Bloom, you'll see what will shock you. Because also from the setup, the settings, the reception, they are really ready to do something to you. We have goodies. So
that is coming,
In fact, I think you have to come and receive one. Maybe our doctor is to officially maybe invite you for that. And thank you very much.
Okay, thank you so much. It will be my concern to make sure that I visit that hospital and I see what kind of services they are offering, and I will be one of the biggest. I will come with the testimonies. Dr. Shihab. Now, this is just a general talk. How is the environment here in Kenya? Working here in Kenya, how is it? How can you tell the public? Do you enjoy the environment here?
Yes, Kenya is a very nice country. I actually enjoy my stay here at Kenya. And by the way, I'm Egyptian doctor. So if I compare, Kenya is one of the best countries I have ever visited. All over the world, I have visited more than 10 countries. But Kenya, I actually enjoy my stay here at Kenya. The people here are very kind, and also I enjoy that I support the healthcare system as a profession, as a consultant of urology, and I appreciate that the feedback that I have got from the people in the community, the clients, my patients in the clinic. I appreciate a lot this feedback that I have got. And since I came here, we have a series of successful cases that we have done at Bloom Hospital, starting from prostate cases, laparoscopy, in the urological cases, and those for male infertility issues. We have a long series of successful cases.
Okay.
All of them are very satisfied.
Wow, thank you. What a good, it's a nice feeling. And when we hear people praising our country, you know, it makes us feel good. And we hope that one day we can also travel to Ethiopia and see how things are working there. It will be good. Your parting shot as you wind up. You are parting shot. Anything you want to tell the public as we wind up, sir?
First of all, I want to thank you about this interview. And again, I usually wrap up my interviews by saying, listen to your bodies. This is my advice to all of our audience. Listen to your bodies. Take care about your bodies. The health of your urinary tract or urinary system is very important to the health of your body. Seek for a medical advice once you have any issue or any problem about your body, and make a regular follow-up checkup.
Okay, thank you, Mr. Sila. As we wind up, your parting shot, anything you want to tell the public?
Okay. to our valued clients or customers, first to doctors, to corporates, and maybe insurances, and also the residents of Nakuru. We really say thank you for having walking a good journey with us. You have been supportive to us. And also, I just want to say Bloom Hospital actually has come for the sake of the health of the people of Nakuru, first Nakuru, then other places. So I'm happy also to be there. You can see my feeling. Yes. So I'm really happy. Thank you very much.
And I'm also happy for having you today. It has been a very engaging session, and I think we are going to get medical services at Bloom Hospital.
You're most welcome to visit Bloom Hospital at any time. We are here to assist.
Thank you so much.
Welcome.
Na mtazamaji, kufikia hapo basi tunasema asanteni sana for those who have been with us. Thank you so much for your collaboration on Facebook and via our WhatsApp number. Till tomorrow, have a blessed day.